Namaskar and greetings to all of you. It's my pleasure to receive you all and welcome you to this first of the series of Friday social dialogues on COVID-19. It is jointly organized by Thair Policy Center under its flagship project of Smart Campus Cloud Network and Faculty of Sustainability Studies of MIT World Peace University. This brief dialogue, which I expect not to take more than 30 minutes, is taking place in a virtual space. And our expert for this dialogue today is Professor Dr. Joe Thomas. Joe is known as a public health diplomat and has represented at UN General Assembly and World Health Assembly. His experience on global health and social development for more than 2 decades makes him absolutely unique as a speaker today for a social dialogue on pandemic COVID-19. Presently, Joe is an associate dean for Faculty of Sustainability Studies at MIT World Peace University. He leads the School of Public Health there. And my name is Rajendra Shende, chairman of Thair Policy Center, which is a not-for-profit organization. And I'm also former director with United Nations Environment Program, and I am IIT alumnus. I must mention that I am also coordinating lead author of IPCC report of 2007 that won the Nobel Peace Prize. So here we are, and let me begin by saluting the year 2020. So many of you would wonder why I'm saluting that year, which was full of human sufferings and unprecedented events, which probably we never even dreamt of. But I'm saluting with some kind of a hopes that 2020 gave. In the same year, we had a first trial of vaccine. So no doubt 2020 brought us human sufferings, but it also gave us a vaccine, which we were waiting for all along, every day, maybe every hour. And we thought that once the vaccine is there, all our sufferings will end. And that is my first question to Joe. Will this vaccine end COVID-19 pandemic? Joe?
Thank you, Dr. Shende. And it is indeed a pleasure and a privilege for me to be part of this dialogue. And I thank Thair Policy Center and also MIT World Peace University. And I thank my colleagues at the Faculty of Sustainability Studies and also the School of Public Health colleagues. Thank you. And I agree with you that year 2020 was a significant year. And we suffered extensively, the entire human population. Probably out of the 7 billion population, I would say 99% of the people must have affected by the COVID pandemic on various ways. And also you rightly pointed out that the science finally, the triumph of the science, that is what we witnessed. The science finally managed to come out with a vaccine, not one. Already there are 3 major vaccines, there are 2 other countries, they have their own vaccine. Almost 6 vaccines are right now being used, and probably another 20 plus vaccines, candidate vaccines are in the pipeline. But your question is very important. Will these vaccines, is it going to end the pandemic? I would say to some extent yes, but some extent no. Let me explain this little ambiguous statement. we are dealing with in one way, very fragile virus. At the same time, the complication of the virus is very complex. We know today we can prevent the infection, the pandemic, through very basic precaution. Taking care of the say, physical distance, using masks consistently. I'm not using the mask now because I'm in a closed room. There is no one else is visiting, so I removed my mask since I'm in a private space. And also we're using sanitizer and using other protocols for the COVID pandemic. We may be able to prevent to a large extent. And the vaccine is going to be one more tool for in our ammunition to deal with the pandemic. So it may not end the entire the pandemic to a large to its complete or its totality. In fact, what we have to learn is that along with the vaccine, we have to learn with how to live with the virus. So that's the main point. And I can elaborate a little more. For example, out of the 7 billion population, probably less than, say, 100 million population must have already received the vaccination. A global scaling up of the vaccination require probably 2 or 3 years, the time factor. The logistics of distribution of the vaccine is phenomenal. It is not only logistics, you need to train them, the healthcare providers, how to administer the vaccine. We need an elaborate monitoring system. What are the drawbacks, any side effects, and also what are the long-term health impact? We need an extremely developed healthcare system to look at them, to monitor the after effect of that. And also there's we had to look at the production capacity of the countries. Probably only 4 or 5 countries in the world has the capacity to manufacture the virus, the vaccine to the COVID pandemic to that extent. The kind of, that the vaccine, the quantity we need is phenomenal quantity. And that the capacity is very limited. And also in many countries, they have something, what we call it as, they give priority for their own citizens. And we also coined a term for that, vaccine nationalism. You give the priority for your own citizens to give vaccine before you demonstrate your altruism or your diplomatic credentials. You try to focus on your own people. So this creates further complication. And also remember the COVID pandemic, one person, one patient anywhere in the world is that person can demonstrate or transmit the infection anywhere in the world. So this is one of the issues. So unless we reach out to the last person and ensuring that no one is left behind in the vaccination process, we may not be achieving the complete control of the COVID pandemic. Thank you.
Yeah, Joe, I understand this situation, but the key question comes to many of us in mind is why the vaccine should not end the pandemic. Because, for example, we are given to understand that polio has been eradicated because of the vaccine. And there are other examples where the total eradication is going to happen soon, maybe smallpox. So why in this particular case, the vaccine should not end the COVID-19? I just want to add a supplementary things there, because is it because the dash or the hurry that the whole world went through? Because in less than 1 year, we had a vaccine. And normally the vaccine takes about 10 years or around that. And here we rush to it. So is it because the vaccine is premature, or is it because of any other reason?
Your question, let me answer one by one because it's very important question. When I say the vaccine may not end COVID pandemic, I'm keeping a time frame in my mind. It may not end within 2, 3, or 4 years. Eventually, we may have we'll win the virus. When I say we will win the virus, means number one, a saturation of the population with either with the vaccination or with a natural immunity, what they call it a herd immunity. When it hits a significant percentage, Along with the vaccination, then we'll have a mastery. We will control the epidemic. So it takes some time. Probably I cannot immediately give a time frame, but not within 2-3 years. So this is one part of it. And we know that we have success in about almost 25 vaccine controllable diseases in the societies going around. And any child born today's world, minimum they have to take about 5 to 6 mandatory vaccination. So this is a second aspect. The human being, human society, human civilization, we have the capacity to control many of the diseases. And we eliminated some of the diseases. From that point of view, I have no doubt that within certain time frame, we will control the COVID pandemic as well. So that's no doubt, but there's a time frame for that. The third issue what we're talking about is that globally there are vaccine skeptics and there are vaccine hesitancy. Many people are reluctant to take vaccine because of many reasons behind it. You also mentioned one reason that didn't we manage to rush through the vaccine discovery. I would say that it is not a rushed job. And we have to remember that our scientific advances is in not only in the medical discovery, it went on various aspects of our scientific discovery. Today, our information technology has phenomenally expanded. That means when we do a clinical trial anywhere in the world, the data is real time, it's transmitted to the regulators. Earlier what happened, you had to manually compute the data. Then you manually submit it to the regulatory authorities, those who give him permission for the vaccine and those who evaluate the vaccine trial. Today, online, we can get the data on the vaccine evaluators, independent evaluators, public, and also the data is on the scientific journal and in public, for the scientific community. And this is a tremendous achievement of the science, not only for the clinical trial. How do you manage the data? And today we know that information technology has created a data revolution. And one way when we say that we rush through the process, clinical trial process, actually, we are taking the complete advantage of the scientific advancements in the science and technology, particularly information technology. And our capacity to manage large amount of data, our scientific, our software has enormous potential to crunch large amount of data and look at hundreds of thousands of variables simultaneously. This advancement is what has helped us to understand and also look at the efficacy of the vaccines on a real-time basis. So many people...
So assuming, Joe, that we did use the modern technologies to ensure that the whole process of discovery of vaccine or developing a vaccine is mature. So we should not say that, well, it was a hurry. I think mainly the speed was increased or speed was very high, mainly because the kind of technologies that we used. Now, question comes to my mind, and be sure that I'm not a public health diplomat. I'm an engineer. So why it is not given to a newborn child? I mean, for example, any newborn child goes through certain vaccination process now. There is a protocol that you should do that in this month, next month, repeat it after 6 months. So why this vaccine is not given to newborn to ensure that no time in his life or her life, there will be COVID-19?
And very good question that many people doubt that why children are not vaccinated for the COVID pandemic. It's a very important question. What you remember is that COVID pandemic, where the human beings started dealing with it only for 1 year ago, approximately maybe by December 2019. So our understanding about the virus is not complete picture. We cannot say that. See, for example, when you look at the pandemic prevalence, somehow younger population, particularly children, are not affected significantly. And the children's immunity is a mystery for the vaccine researchers, the COVID vaccine researchers, why children are not, particularly small children, are not affected by the COVID pandemic. In many parts of the world, children, even parents are infected. Children are largely left out. I'm not saying the children are completely left out. So the children's the immunity towards COVID vaccine is still a scientific mystery. But let me tell you that there are vaccine trials are being initiated focusing on children as well. And also when we did the clinical trial, initially it focused on what we call it as broadly the productive population group. Even we left out the older population. So we focused mostly on the, say, 50 below or maybe the 18 plus. One reason is that they are the most significant the productive force of the society. Maybe that's a bias, I would say that. And also, yeah, and coming out with a vaccine for the entire spectrum of the population was not feasible at the immediate stage. So we looked at certain particular population group and did the clinical trial. At the same time, now the clinical trial is also focusing on children's immunity and immunization needs. So that way, that's one reason why we are not having a vaccine for the children immediately. There are two reasons. We are still in the scientific discovery process. Second, children demonstrated some significant, some unique form of resistance towards COVID pandemic, COVID virus. Hope I'm
Yes, Joe, Joe, there is a widespread feeling that there was no enough collaboration or cooperation between the countries to have a joint front to deal with this attack on humanity by microorganism. And we were totally exposed. I mean, just now you made a statement that we have not understood that virus very well yet, not in a full extent. But at the same time, we did not try to get and have what is called as a multinational cooperation in order to develop the vaccine or develop the next vaccine or develop the next to next vaccine. Uh, because we all knew that this virus is going to have its own revisions and it is going to have its own amendment and come in the form of a different microorganism. So do you feel that we did not have what is called as a cooperative mechanism for research and development of vaccine?
I completely agree with your observation. And perhaps COVID pandemic is one of the best candidates for exploring our skills for global health diplomacy. I think I may explain it a little further. COVID pandemic is actually, it's an international relationship issue. When you talk about health diplomacy, we are applying the principles of international relationship in expanding our health-related interest and investment. That's the gist of health diplomacy. The COVID pandemic is a truly globalized disease. We know that in November, end of 2019, the virus was reported in Wuhan. And by January, it was in the Europe. And then February, March, it was in the United States. And from Europe, it went to United States. And then it went to UK. So if you look at the transmission cycle, it's truly a globalized pandemic. But at the same time, responding to the pandemic, the global community's response was not that the diplomatic enough, that kind enough. See, for example, UN Secretary General Guterres, he called for a peace, called for a ceasefire, global ceasefire to address the COVID pandemic as a priority. More or less, most of the global leaders literally ignored that call. And also there is a global, WHO called for a global facility for creating the vaccines under the umbrella of a Global Alliance of Vaccines, Gavi mechanism. The WHO's that a humanitarian initiative to create a vaccine and share the vaccine, and that is still not picked up. And if you look at the access to vaccine, COVID vaccine, one of the significant issues is the trade barriers. Even today, we have the technical know-how how to manufacture the vaccine. It's monopoly of few companies. And remember that the vaccine research is done with the public money. United States taxpayers paid the significant part of the cost of creating the vaccine. So the vaccine is not created with the private money alone. The significant part of the money came from the public money. So then the natural, the argument is that if the vaccine is created through public money, the vaccine should be publicly available. The patent should be publicly available. In this context, I would say that Government of India and South Africa submitted a memorandum to the World Trade Organization saying that the trade agreement related to the COVID pandemic and the medicines and diagnostics should be suspended for the time being, so the global community can manufacture it. There are different trade mechanisms which facilitates the manufacturing of the COVID vaccine in a tremendous way. Because right now the manufacturing is done by only 5 or 6 countries. But many countries got the capacity, but they don't have the know-how to use it for manufacturing. Even a country like Bangladesh, they're experimenting with the COVID vaccine, but they can't do it because they don't have the full formula for creating one. But suppose the World Trade Organization, under the umbrella of World Trade Organization, you suspend the trade intellectual property right at least for some time, for 2 years, 3 years, maybe 7 years, exclusively for the COVID pandemic, COVID-related diagnostics and COVID-related vaccines. This will be the success of the global community. Because remember, one country cannot recover from the COVID pandemic. If you're recovering, you have to recover from anywhere in the world and everywhere in the world. The moment you leave one behind with the infection, that infection can come back and everybody can have it. So this is the principle behind it.
So in short, Joe, 2020 and 2021 are the good examples where we fail to cooperate. Whereas the United Nations keeps on talking about developing a new cooperation on new issues, where we definitely failed in it. Though the public money was available, the public were not really participating in it on a global scale, which is very sad, because we probably have not presented COVID-19 as an example that how we will deal with abrupt and a planetary scale crisis, which of course that is not a subject today, but our next pandemic is considered to be climate change. And I'm sure we have not learned a lesson from COVID-19, and we are still not cooperating in a climate change issue. But coming back to the vaccine issue, I think you pointed out an excellent story of Antonio Guterres, United Nations Secretary General, where he called for, while the pandemic is going on, stop all the wars which are happening bilaterally or multilaterally. And as you said, many responded, but not all of them responded. So some wars are still on. And we read that in the paper, there is no need to spell it out. So while we keep on fighting the war on pandemic, we are not stopping the political wars. Neither we are stopping the geographical amassing the land and trying to say that, okay, this land is mine, that land is yours. So we never stopped all those kind of things, though we were supposed to fight pandemic. So I have a question with related to this kind of a phenomenon. See, we also have read in the paper that while pandemic was on, certain race to reach out to the universe was still on. I mean, recently we saw that US NASA, the spacecraft to the Mars, that continued, that did not stop. So while we were engaged in a stimulus packages to give it to the poor people or for reducing the sufferings, we continued to spend the money on these kind of projects where we wanted, or the countries wanted to be the first to do that, the first to have your a craft sliding on the Mars. So the way the ceasefire on a war was proclaimed by Antonio Guterres, why there was no similar call for stopping certain issues like a spacecraft or launching of satellites, because we wanted to fight the war in pandemic on the earth first?
I'll be a little more considerate to the scientists who are working on the satellite systems and the extra, intraplanetary transport systems. Why it is, and probably we may have to do some of the scientific experiments outside the orbit. Because remember that the virus, how it may behave in a extra terrestrial space, that may be a very scientific, very interesting scientific discovery. So I'll not be completely dismissing the satellite technologies or the satellite expedition. So at the same time, definitely I'll strongly advocate for the need to stop the madness of war. Look at the Syria, 10 years it's going on. And I'm not naming our neighborhood. There are many countries. So these are unproductive waste of resources and the destruction of the environment. That need to stop immediately. And the scientific discovery, because the space exploration is the exploration of science. We are trying to expand the boundaries of science. From that point of view, we have a lesson to learn from how the virus may behave in a non-gravitational setting, maybe in the space setting, maybe intergalactic settings, how it may behave. So that has got a plus point. But definitely what we look at is in our own environment and how the natural calamities are coming up. You mentioned about the next major pandemic as an environmental disaster. I would go a little further. The next pandemic may be a combination of a natural calamity and an epidemic. A public health calamity along with an environmental calamity. Just imagine that. Both simultaneously, right now we cannot deal with one, the after effect or the side effect or impact of COVID pandemic itself. Suppose simultaneously there is an environmental catastrophe, environmental crisis of a global nature. See, we never imagined how a pandemic can completely keep the world on its knees and completely stand still. Imagine the mighty airlines are just sitting idle. The mighty airlines and the travel industry, the tourism industry is completely standstill. Even 1 year ago, we never even conceptualized, imagine in our worst dreams about it. Similarly, the next environmental catastrophe also could be beyond our day-to-day imagination. But I'm going one more further step ahead. A natural calamity of unimaginable quantity along with a next pandemic. That probably that next pandemic may come from interaction between the wild animals in the wild and the human being. Because of the shrinking environmental space wild animal has got. The interaction between the wild animals and the human beings are increasing now. And because the human beings are encroaching into the space of wild animals. And we know that some of the wild animals are the reservoirs of viruses like COVID virus, and at what stage that the species jump of the virus can take place, we don't know. So from that point of view, there are 2-3 things. One is the human civilization should focus more on the scientific expedition, scientific experiment. At the same time, there should be a long social movement against war and destruction of environment. Third, we should be more concerned about what is the next future of the pandemic and natural disasters, how this is going to deal with it. Third, I would say that probably we are talking about reconstruction of the post-COVID world or post-COVID society. Maybe we should have a green economy and healthy economy focusing on investing on health. So what?
Hello?
Hello?
Yes, go ahead.
Yeah, because what happens is that the resources required, if we invest in health, and health will lead towards economic stimulus, health will lead towards innovation, investment in health lead towards better health and well-being, and healthy population is an essential infrastructure for the sustainable development. So maybe the lesson from COVID pandemic is that invest in health. Keep health as the first priority for investment. And learn lessons from the COVID pandemic for getting ready for the next pandemic. And
yes.
Be prepared for dealing with or a strong advocacy towards stopping all the wars around. And we have an opportunity that G20 meeting is coming in London in a few months soon. Maybe the civil society should call for a people's vaccine, people's COVID vaccine at the G20, and also request the G20 to suspend the trade-related intellectual properties for a short time so that COVID-related pandemic diagnostics and vaccine could be produced on a massive scale, on a rapid scale all over the world. Thank you.
I, I understand, Joe, that we have to keep the priorities straight. But those kind of priorities are coming in our mind only when we are in it with fully drenched. That we started talking about prioritizing the health sector only when there was a planetary level sufferings and a pandemic. But still, going back to my earlier question, we did not deprioritize certain expeditions which could have waited for maybe a couple of years, because you remember that NASA gave up the human beings to be sent to the moon for a couple of years. Maybe they are now thinking about it. So we didn't lose much. I know that man always wants to explore, and that's why he's called as a human being. So you cannot really stop the adventures, explorations. But the key question comes that we have not even understood our own microorganism, which is troubling us, and we keep on launching to the Mars. And then people ask where the money is going to come for into the health sector. I mean, probably the money into the health sector is going to come from prioritizing certain issues and not to spend the money just to satisfy our exploration skills. What do you think?
I agree. At the same time, I would like to present a different point of view. Suppose the entire world is suspending their arms and ammunition. Suppose the entire world is decommissioning the nuclear weapons. Suppose the entire world is suspending the intercontinental ballistic missiles. Suppose the production of the military jets for at least for 1 year. Imagine the profit we are making, the money we have to build a healthy system. So that is the priority we're talking about. And we have to talk about human security, not the border security, or border security and human security together. I'll give another example about it. Almost 80,000 doctors died, doctors and nurses and healthcare providers died in India. And there is not much of a media attention or an outcry about it. But suppose 80,000 soldiers would have died in anywhere in the country. Imagine what would have been the hue and cry, and not negating the contribution of the soldiers, and just giving a comparison. The doctors, nurses, healthcare providers are as important human security soldiers. And they are committed to save lives. And their lives should be protected. And that should be the priority. For that priority, if you had to suspend the national defense mechanism slightly adjusted through a global diplomatic engagement, saying that no war for 1 year, then we suspend the production of arms and ammunition. Then we suspend the production of the deadly weapons. Then we have the money we're talking about, because the money we spend it for again, the space exploration is a fraction of what we spend on arms and ammunition. So this is what we're talking about. We have the priority here. We should utilize our international capacity, international diplomatic skills. Number one, ceasefire. In the context of COVID pandemic, a ceasefire. Second is that trade-related barriers for production and manufacturing of the virus, the vaccine, and the diagnostics. And the third is that a global community unilaterally declared that we are going to stop the production of weapons of mass destruction, to have a mass salvaging of the society. That's what global community is looking forward. That's what we talk about, diplomacy of a new kind. And that's what we call about literally the statesmanship we expect from our global leaders. And I hope this G20 we can expect that there'll be some similar kind of thing, but then provided the civil society demand for that change. You have to remember that the COVID pandemic is the first infectious disease, the pandemic displaced the space of the civil society. All over the world, the governments led the COVID pandemic response. In that process, they utilized the principles of militarization, not necessarily the principles of public health, the principles of compassion, the principles of the right to life. So this is an issue. We have to rediscover for a people's vaccine a vaccine reaching the entire globe and reducing the vaccine-related inequity, phenomenal inequity. For that, we should expect a great global statesmanship from the global leaders. And the civil society's responsibility is demanding a global response and a national response, giving health as a priority, giving health security, human security as a priority of today's world. We can't afford to allow our older people to die unnecessarily. If you look at the COVID pandemic, our social policies, political programs failed the older population. Why they died? Not because we don't have technical know-how. We didn't invest enough for saving the older population in the world. So this should be the message. The ageism inherent in the global public policies is dramatically came out and allowed the older population to die needlessly. They could have postponed, they could have contributed significantly to the health and well-being of the population. They could have contributed to the knowledge level. They are scientists, they're doctors, they're physicians, they're healthcare providers. These are the people who are died. So our priority should be very clear. Number one, vaccine should be accessible to anybody, everybody. Number two, people's vaccine should be the priority of the civil society. And any vaccine initiative should address the health inequity. When vaccine policies are there, we should make sure that the inequity is not improved or increased by the vaccination program. And the third is that resource allocation, we have to look at more innovatively, probably looking at a comparison between the border security issue and the human security issue. Today, undoubtedly, we should give priority for the human security, at least for some time. And in that context, vaccine is one of a small ammunition in our kitchen. But what we need is a policy level, program level, idea level, thinking level. We need to make dramatic changes to deal with the COVID pandemic. Thank you.
Thank you, Joe. I think that is a great end of today's brief social dialogue. We definitely try to avoid getting into technicalities of virus, technicalities of vaccine production, and also those intricate things, and try to keep it at a social dialogue. And your conclusion of three main issues which bring into the inequality, accessibility to everyone, and also making sure that we prioritize the things in a right way. I think they have come out very well. Thank you very much. I just would like to tell everyone who is participating in it, not only in directly in this particular conversation, but also on a Facebook and other media, that we will be continuing this social dialogue. I mean, maybe I will be replaced by someone or Joe will be replaced by someone, depending on a topic. But we would like to keep it as a social dialogue. And to use Joe's term, let's make it a people's dialogue and not a diplomatic dialogue or not a scientific dialogue. Let's make it a people's dialogue and try to see what exactly we are learning from this, or the lessons are slipping from our hand as the vaccine proceeds and reaches to many people. Is quite tempting that the lessons could be forgotten. And I think that we should never do. I mean, we may lose some of the war fronts, but we should not lose the lessons. And that exactly is the objective of this social dialogue. Thank you very much. If you have any questions, I'm sure you must have put it in your chat. And if not now, probably next Friday, we can come up with answers to that. So thank you very much for your patience, and do give us a feedback saying that what more we can discuss in such kind of a dialogue. Thank you very much. Thank you to all of you.
Thank you. Thank you very much. It was a great pleasure indeed, and it's a privilege. Thank you very much. And I look forward to similar dialogue in future as well. Thank you very much, and have a good day, and bye.
Bye.